Congressman Nadler and I hope to pass this year the James Zadroga Health Compensation Act with the support of Speaker Pelosi and also President Barack Obama. But even with the President's support, it's very difficult to pass legislation. We're going to be trying to do it as quickly as possible, but in the interim, we need someone in the government to take charge of the 9/11 health issues and make sure that the heroes and heroines get the support that they deserve. And I can't think of a better person for the job than Dr. John Howard, who built the federal government's 9/11 health response from the ground up. He was responsible. He made it happen. He is trusted. He is really excellent. And unfortunately, no one has been coordinating the 9/11 health response efforts and providing overlooking the entire system since Dr. John Howard was removed from his services. We hope to pass this bill, and this bill would make sure that everyone, workers, responders, community residents, that everyone who is exposed to the deadly toxins are monitored, and everyone who is sick is treated. Not this year, but every year, for 30 years out, so that people that may be well now, but may be sick with cancers later on, will have the treatment in place to provide the health care they deserve. The 9/11 heroes and heroines were there for us. We need to be there for them with their health care. It is the least that we can do as a grateful nation.
There simply was no reason for Dr. Howard to be removed from his post other than the fact that he was actually doing the job. Now, along with my colleagues and friends here today, I urge President Obama to make a real break with the Bush administration's deplorable lack of commitment and, one must say, enmity to 9/11 victims, and embark upon a new era of compassion and responsibility, beginning with the reappointment of Dr. John Howard as 9/11 Health Czar, so that Dr. Howard can coordinate the programs which have been funded by Congress, which President Obama is pledged to continue and to increase. And the second item of unfinished business, of course, as Carolyn mentioned, is to pass the 9/11 Health Responders Act, the James Zadroga Act, which we have reintroduced, which will provide for an ongoing, permanent monitoring and provision of monitoring and healthcare services to first responders all over this country and to community victims and residents who are also victims of the 9/11 toxic contamination. But pending that, and even after that, we need a 9/11 Health Czar. And there was no one better than the one person who's shown that he was dedicated to it and that he could do the job excellently and was fired for that reason by the Bush administration, Dr. John Howard. So we're asking the new administration to reappoint Dr. Howard to the vacant position of 9/11 Health Czar now. Thank you very much.
Thank you, Jerry, for your leadership.
The issue here is really very simple. The reappointment of Dr. Howard represents the need and our demand that these injured workers, the first responders, the people that were here in this neighborhood deserve the best care. They deserve excellence. Part of this whole thing is to develop a healthcare system that gives them the best possible science and helps them with their injuries, which they received through no fault of their own, which they received as a result of an attack on American soil, which they received because they were willing to give up their lives to help people get out of that terrible crash of the building. I also want to take a minute and say that this is just one component of what all of us here, all of this community is trying to do. And that is to pass legislation that would guarantee that if you were involved in this thing and it resulted in a serious disease, that this country would stand by you and make sure that you had the health care to at least get through the worst of this problem.
Yes.
So I want to say thank you again to all of you, and remember that the mark of a country is how they deal with those people that have fought for that country. We've always felt that we had a certain obligation to our veterans, and we certainly do. But those men and women that were part of this terrible tragedy and responded and were living in this neighborhood and were felt by this deserve the same care as we give our veterans, because they in fact gave the same sacrifice.
We are not begging. We are telling the president, we are imploring the president to reinstate Dr. Howard. I had a chance to meet Dr. Howard in my angrier years, and I took my shoe off. And I said, Dr. Howard, look at my half a foot. Look at this foot, and let that be a reminder of all of these men and women that are sick and dying. He said, son, I'll remember. Not only did he remember, he called me a couple days later, and he said, what can I do to help? That's the type of man he was. I shook his hand. I felt the goodness in him, and he was fired for doing his job. I don't understand that concept. Sir, if you made hamburgers, and I said make 100 hamburgers in an hour, and you made 100 hamburgers in an hour, why would I fire you? Makes no sense.
Unless you didn't really want the hamburgers made.
Exactly. We need to rehire this great man, and we need to pass legislation now. Not in 3 months from now, not in a year from now. HR 847 will ensure the health care of these great men and women behind me. These two people have spent their last 7.5 years putting together a bill suitable to go through Congress. This is America. This is the United States, the greatest country in the world. And we certainly have not acted like it since 9/11. Bad politics and poor leadership, except for these handful of people, have caused more men and women to get sick. That's unacceptable. Unacceptable. I will stand by you guys until I can never walk and talk again, but we're going to continue to fight, and I guarantee 2009 is our year.
And we will stand by
Thank
you
you.
until we pass this bill. Thank you so much, John.
I was a paramedic here on 9/11. I got dispatched from Queens. I survived the collapse of both towers on 9/11, and I almost died. I lost 16 friends between the police officers, cops, and EMS workers. And 5 weeks to the day, I had suffered a massive stroke, which left me paralyzed. And they knew that my paramedic career would be over. But my mindset was, if I could survive 2 towers, I could survive a beautiful stroke, and I came back to work. Subsequently, over the next couple of years, my health deteriorated, in which I could no longer work anymore. Dr. Howard was a fine man who got in trouble for saying that he found it very worrisome that he found correlations with people like myself who took 2 medicines before 9/11, the 2 I took before 9/11, and because of 9/11, this is what I currently take now. And because of that, and Dr. Howard found that to be worrisome, the Bush administration did what I call the 4th of July massacre, and they fired him when they thought that no one was paying attention on 4th of July. And that was an absolute disgrace. Right now, today, we have a new administration, and President Obama, I would ask you, as I've asked George Bush on numerous occasions, President Bush on numerous occasions, sit down and meet with John Feal, meet with myself and some of the other 9/11 responders, and hear what we have to say. We stepped up to the plate. We have all this money that we're giving out today for bailout for companies that were acting irresponsibly and acting shamelessly. There was nothing shamelessly about the actions or recklessness of the heroes on 9/11, that we stepped up to the plate to save our fellow Americans. Not only the firefighters, the EMS workers, and the police officers and the construction workers, but also the volunteers. And let us also not forget the true unsung heroes are the residents of Lower Manhattan who've still been here, who've been living in this toxic soup, and yet they're still being forgotten.
What can the average citizen do to help make this bill pass Congress?
Well, they can talk to their own member of Congress, obviously, and to the 2 senators from their states, whichever state it is.
And to the mayor of New York City.
And come to our city council hearing when we have that to emphasize that we are all one in this demand.